in this part. Let's accept them too. And let's say hello for everybody once again. And we are continuing the second part of our lecture. The second part includes the beta antagonists, okay, beta adrenergic receptor antagonists. Now we will be learning these antagonists. In the previous weeks earlier, and we have already learned about. Wait, what is going on? Why it is not appearing in the full screen? So for now, I don't understand. Wait now, guys. Okay, then we can continue. So we have already learned about the alpha antagonists, alpha receptor antagonists. Now we will be continuing with the beta antagonists, okay, beta adrenergic receptor antagonists. So here with these parts we have already learned. Let's make a quick review for the previous topics too. We have already learned about the mechanism of action of alpha receptor antagonists, and these are the types of the antagonists. And the main important antagonist types are this one, okay, phentolamine, phenoxybenzamine. Phenoxybenzamine is the substance which was used in order to treat pheochromocytoma. Okay, so you need to have already learned about it. Azosines and tamsulosines, we have learned about these drugs too. All of the drugs, what type of effects do they have? We have already learned. And what type of diseases they are used to. We have already learned them too. Okay. And what else we have? Phenoxybenzamine. Okay, this is used in order to treat pheochromocytoma. We have seen it. Okay, and phentolamine has been used in the treatment of also pheochromocytoma, but not so. It's not so selective as phenoxybenzamine. Okay. Now let's continue here. Prazosin 2. Prazosin, we have already learned about this. So it is used in the treatment of hypertension too. Okay. Now let's continue then. Terazosin used in the for the treatment of BPH, benign prostatic hyperplasia. Now about this disease, we have already learned that this is the disease which is related with the enlargement of the prostate. Okay, so when people have this type of disease, they will be having difficulties when urinating. Okay, because of and some tissue will be enlarged in there, and there will be a uncontrolled growth of tissue in the prostate, so which results in the urinary retention problems. Okay, so that's why it is here important to terazosin. Okay, so terazosin is used in order to treat this disease. Okay, now let's continue then. Doxazosin is also used for the BPH and hypertension too. Tamsulosin is also used for the BPH treatment too. Okay, and let's continue. Yohimbine, another one. Clinical pharmacology of the alpha receptor blocking drugs. Let me turn off the sounds of the students because there are some noises coming. Okay. So we are continuing here. And now hypertensive emergencies. For the hypertensive emergencies, labetalol is used. Okay. And for the chronic hypertension, prazosin family is used. Members of the prazosin family. Another one. Now, all of these parts we have already learned. We are continuing with our beta receptor antagonist drugs. Okay, what's basic pharmacology of these beta receptor antagonists? Most beta blocking drugs in clinical use are pure antagonists. And so that is the occupancy of a beta receptor by such a drug causes no activation of the receptor. So, however, some are partial agonists. Now, there are also some partial agonists too, which may have also additional activity in different types of receptors too. Okay, so for example, that is, they cause partial activation of the receptor, albeit less than that caused by the full agonist epinephrine and isoproterenol. Okay, so let's move on here. Pharmacologic properties of the beta receptor antagonists are one of them is absorption. What about the absorption? Most of the drugs in this class are well absorbed after oral administration occur. Now, guys, who is turning on the sound? Okay, then. And now I have turned off the sound of students and we are continuing, okay? Now, peak concentrations occur from 1 to 3 hours after ingestion. Bioavailability for the drugs and propranolol undergoes extensive hepatic metabolism. Its bioavailability is relatively low. Now, the distribution and clearance. The beta antagonists are rapidly distributed and have large volumes of distribution. Propranolol and penbutalol are quite lipophilic and readily cross the blood-brain barrier. Okay, the important part here is, and according to their structure, lipophilic structural substances can easily pass the blood-brain barrier. So, for example, there are some antagonists which can easily pass through the blood-brain barrier, and they can be used for what as an antidepressant too. Okay, so what is the why do people have the depression? Because of the lower, very low amounts of norepinephrine and serotonin. Okay, norepinephrine and serotonin levels, when they are really decreased, people are having they may have the depression too. In order to cure these type of conditions, and the spatial their antagonists must be used, and which increases these levels of the norepinephrine and also the levels of serotonin too. Okay, so let's continue then. And the distribution of and clearance, and the beta antagonists are really distributed and have large volumes of distribution. Now, in these parts we have already talked about. Most beta antagonists have half-lives in the range of 3 to 10 hours. A major exception is esmolol, which is rapidly hydrolyzed and has a half-life of approximately 10 minutes. Now, there are also some special drugs which may end up very quickly metabolized. Okay, and now let's continue then. Pharmacodynamics of the beta receptor antagonists. Effects to the cardiovascular system. So in here, beta blocking drugs given chronically lower blood pressure in patients with hypertension. Now, another one, beta receptor antagonists have prominent effects on the heart and are very valuable in the treatment of angina and chronic heart failure. And mostly these beta receptor antagonists are also used for the treatment of hypertension, which are related with this cardiovascular system too. Okay, one of them is the cardiovascular system, another one is respiratory system too. So in the respiratory system, for example, when people have asthma and these type of conditions, and it can be also used as the treatment drug, okay, for the special types of disease. Now, beta, here we have beta blocking drugs given chronically lower blood pressure in patients with hypertension. Beta receptor antagonists have prominent effects. And now effects on the respiratory tract. Now we have another students too, but the number of what is going on, guys? Someone is singing in there. Guys, you now need to turn the microphone on because it is the lecture time. It's not the practical class. Okay. So blockade of the beta receptors in bronchial smooth muscle may lead to an increase in airway resistance, particularly in patients with asthma. Okay. So when there will be, it needs to be what it needs to be thought about, and the patients, if do they have asthma condition or not, and according to that they need to be giving the beta 2 receptor antagonists. Okay, so they need to be aware of them if the patient have asthma or similar type of diseases too, because it may be important, and so people may have struggling with this type of disease. Beta-1 receptor antagonists such as metoprolol and atenolol may have some advantage over non-selective beta antagonists when blockade of beta-1 receptors in the heart is desired and beta-2 receptor blockade is undesirable. So let's continue then. Effects on the eye. Now, so what happens with the eye? Here is the important disease here related with the eye. Okay, and now what happens is beta blocking agents reduce intraocular pressure, especially in glaucoma. Now, glaucoma is the certain disease which is related with the intraocular blood, intraocular liquid pressure. Okay, and now inside of the eye, in front of the iris, there is a special space. Okay, and now this space is filled actually with aqueous humor. Okay, aqueous humor is the liquid which is filled with this. The substance, what is the aqueous humor actually? 99.9% of these liquids is actually water, and 0.1% of it is actually different substances like proteins and other compounds. Okay, and so this type of compounds is called as aqueous humor. Okay, in front of the eye, in front of the iris, this type of liquid is filled with it. When this liquid is being produced in a higher amounts, and there will be occurring the blood, now intraocular pressure will be increased. So this pressure may damage the eye structure. Okay, and when people are having this type of pressure, initially it will not be will not be significant, but later on they may cause some partial blindness, and some area of sight will become a little bit lowered. Okay, so when later on the area of sight will be smaller, will become smaller, and at the end it may become even completely blind person. Okay, and the people who have glaucoma may have this type of results. So in order to treat, and there are special drugs for them. Even in the book there is a special article about this, and now it is named as treatment of glaucoma. Okay, you may read about this treatment of glaucoma, which is really important, and you can find it out from what? You can find it out from the book of Katsum Pharmacology. This is a really good book. Another type of source, later on at the end of our lecture, I will be sharing it with you too. I found out a very good source. Actually, one student has shared with me very good book source, and I will be sharing it with you too. Okay. So metabolic and endocrine effects. Beta receptor antagonists such as propranolol inhibit sympathetic nervous system. Yes.
Sir, there are many students.
Now I cannot accept them because the limit of 100 students has been reached. They will be watching this lecture, but only they will be watching it only after some time. Okay. Because when I upload it to the internet, they will be watching it only later, not now, okay? So then,
sir, excuse me, sir.
We are continuing.
Sir.
Yes.
Sir,
I'm listening.
Sir, okay, sir. Sir, here in metabolic and endocrine effects, the glycogenolysis. So it's the splitting of glycogen in human liver. So, sir, when beta-2 receptor blockade was released, it inhibits the splitting of glycogen.
Glycogen, the glycogen when the beta blockers, it is also yes, it is related with glycogen.
So beta-2 receptor will block, inhibit the splitting of glycogen here. It's drug now.
Yes, it is related with the glycogen production too. And when it will be blocking, it's what it is released to. Okay, the glycogen release too. Glycogenolysis will be stopped at that condition too. Okay.
Okay, sir.
Now.
Thanks.
Not fully stop.
Effects. Now we are continuing, guys. We can ask later on too, because we need to finish it this time. Okay. And now later on you may ask questions too. So we were continuing with what? Beta receptor antagonists inhibit sympathetic nervous system stimulation of lipolysis. Okay, so here when will be an inhibiting of lipolysis, HDL will be increased. Okay, and now HDL will be decreased in there, but LDL will be increased. Okay, LDL will be increased. And we'll be continuing on, and later on too, we'll be looking through about these changes too, after some time, okay? The effects on carbohydrate metabolism are less clear. Also, glycogenolysis in the human liver is at least partially inhibited after beta-2 receptor blockade. Now, it will be inhibited, but only partially after together with beta-2 receptor blockade will be occurring, okay? So the chronic use of beta adrenoceptor antagonists has been associated with increased plasma concentration of VLDL, very low density lipoprotein, and decreased concentration of HDL. HDL is cholesterol substances will be decreased. Okay. Now here we see what drugs and what type of drugs that are used for the treatment of glaucoma. Okay, and now in these all of these drugs are used in the treatment of glaucoma, and you can find it out also from the book. Cholinomimetics are used, alpha agonists are also used, beta blockers, carbonic anhydrase inhibitors, prostaglandins are also used too. Okay. So beta receptor antagonists here beta 1 blockade, the main functions of them is they decrease heart rate, decrease stroke volume, decrease cardiac output too. Now decrease renin release too. So these type of effects are occurring when with the beta 1 blockade. Okay. Another one. Let's accept this one too. Okay. So another one, beta 2 blockade. When the beta 2 blockade will be occurring, and it may precipitate bronchospasm in asthmatics and vasospasm in patients with vasospastic disorders. Decrease aqueous humor production. Aqueous humor we have talked about in the glaucoma in liquid found in our eye. Okay. And now another one, metabolic effects. Will be what type of metabolic effects? Blocks glycogenolysis. Glycogenolysis, we have talked about it too. And gluconeogenesis and too, okay? Now non-selective beta blockers used in glaucoma, okay? So, and this aqueous humor production, by decreasing the aqueous humor production, what happens when there will be a decrease in aqueous humor production, and the liquid inside of the eye will be in a lower amount. If it's in a lower amount, it will not be applying so much pressure, and the eye seeing of the eye will be done in a normal way, okay, without any diseases, without any pain. But what happens if there will be also an increase in this tumor, the vice versa will be occurring, okay? And also another way to treat this glaucoma disease is by making sure that this aqueous humor liquid will be flowing out from the eye, okay? By, if it will be easily flowing out of that area, what will be done is there will not be any high pressure inside of the eye, and intraocular pressure will be decreased by that way, and the glaucoma will be treated in that way too. Okay. There are also types of glaucoma, actually, open angle and closed angle too. You can read it from the book later on, okay? Now we are continuing with our parts here. Now the blood glucose, the blood glucose level will be decreased, okay? And beta blockers. Wait now, guys. Abdul Kabir.
Abdul Kabir,
microphone, okay?
Abdul Kabir, अपना माइक्रोफोन ऑफ करो. देखिए भैया कटा गई.
What's going on?
भाई चुप करके बैठो ना.
So I am turning off the sound of everybody. Why you are turning on, guys? I don't understand them. So let's continue here. Increase LDLs and triglycerides in LDLs, low density lipoproteins and triglycerides. And so when there will be an increase of them, beta blockers prevent the breakdown of triglycerides and adipocytes. If there will be a prevention of breakdown of triglycerides and LDLs, their amount will be increased, okay? So their amount will be increased, triglycerides and LDLs level will be increased, okay? Characteristics of some beta blockers. So beta 1 selective blockers are we can find that out from A to letter M, from A to M, and they are all which end up with olol, okay? They are all actually ending up with olol. Now, if they are all starting from A to M, it means that they are only beta 1 blockers, okay? So beta 1 selective ones, they are all found in this area. But if we are continuing from N to Z, okay, according to the alphabetical order, from M, after M there is what? After M there is N, okay? From all of these parts, they are all non-selective beta blockers, okay? And so in this way, here there are some minuses. ISA, intrinsic sympathomimetic activity, okay? Intrinsic sympathomimetic activities only found in acebutolol and pindolol. And blood lipids are also will be left in here in the pindolol and acebutolol. Okay, both of them have similar properties. Sedative effects have all of these drugs, but except atenolol only two. Okay. So, the most sedative substance is propranolol, actually, here. Now, about the sedative substances, you may, yes.
Excuse me, sir.
We can accept another, yes.
Sir, sir, here is 1 plus 2 plus or 3 plus 1 minus 2 minus. So, sir, that the number show the limitation that here is 3 plus, so
Yes.
propranolol is
They have really high
sedation
effectivity.
rate is
For
high.
example, yes. For example, propranolol, there are 3 classes in here for the sedation effects.
3 plus and 2.
And 3 pluses has really high effectivity of this drug. Now, and they will be also having the effectivity, but not so high as propranolol too. Okay, and timolol also has high effectivity, but do not be having as high effectivity as propranolol. Okay.
Thank you, sir.
Was it clear? I hope. Okay. Now, beta receptor antagonists, the last 7 minutes, we need to finish it quickly. Cardioselectivity for the beta 1, okay? They have less effect on vasculature, bronchioles, uterus, and metabolism, safer in asthma, diabetes, peripheral vascular diseases too. So, continuing here. About ISA, we have already talked. 2 drugs were used in there, which were having the similar properties. And the acebutolol and pindolol were that drugs. Okay, they show intrinsic sympathomimetic activity too. So what does it mean? Okay, actually ISA means that they can act as partial agonists too. Okay. So it may be having the properties of antagonists too, but also they can have the property of partial agonists too. Okay, for example, they can also have the property of agonists of activating the alpha-1 receptors too. Okay, for example, acebutolol 2, another one pindolol 2. They may have the effect of activating the alpha-1 receptors too. Now, less bradycardia will be occurring too. Slight vasodilatation or bronchodilation will be occurring too with beta-2 blockers. Minimal change in plasma lipids will be occurring. Okay, all of these drugs have really high effectivity in plasma lipids changing. Okay, plasma lipoproteins. But what about the acebutolol and pindolol? They do not have any effect in blood lipids and change. Okay, so there can be only small changes, and these small changes can be actually neglected. Okay. Now, pharmacokinetic properties, they do not have the entry to the central nervous system too. Okay. Now let's continue then to have another students entering. Okay, they are entering too. Beta receptor antagonists clinical correlate chronic use of beta blockers like angina, hypertension leads to receptor upregulation. So about the receptor upregulation, this is the condition where there will be really high amounts of receptors located in the cell too, okay? During withdrawal from use, it is important to taper dose to avoid excessive cardiovascular effects, rebound effects of endogenous amines. And we are continuing here. Glucagon and the heart. And the positive phenotropic and chronotropic, not via activation of beta-1 receptors, but through glucagon receptors that are G protein linked to adenylyl cyclase. Now, what was the mechanism of action of beta receptors and their agonists? They are relating with the adenylyl cyclase enzyme, okay? Adenylyl cyclase works together with what type of G protein? They work with G stimulating protein, okay? So when G stimulating protein will be working it, and adenylyl cyclase will be deactivated, so the further changes will be occurring too. Basis for its use in beta blocker overdose too, okay? Now, general uses of beta blockers: angina, hypertension, post myocardial infarct, okay? All drugs are used. All drugs of antagonists are used in for these treatments. Antiarrhythmics, and this is the class 2, propranolol, acebutolol, esmolol. For the glaucoma, and it's used the timolol, okay? Migraine and thyrotoxicosis, performance anxiety, essential tremor is for these type of diseases, and the propranolol is used, okay? Now, combined alpha-1 and beta blocking activity, labetalol and carvedilol. Now, this is important here, that it ends up with ILOL and ALOL, okay? And these are the beta blockers, and also they have another properties too. But if the
Excuse
drug
me, sir.
ends up with just ALOL, okay, it will be used only as beta blocker. Yes, and there were some questions. The last
Yes,
2
sir.
minutes,
Sir,
actually,
mostly of the drugs.
we are continuing. What?
Sir, we saw there mostly of the drugs ending with a all beta blocker only. And if we can say that Panadol, what is it?
What dependent only?
No, no, sir. Panadol.
It,
What
and
is it a beta blocker?
नहीं
beta, yes, it
Yes,
is a
sir,
beta
Panadol.
blocker only. Yes, if it ends up with all, it is only a beta blocker only. But if it ends up with ILOL, for example, or ALOL, it has also the beta blocker property and also another type of property too, okay? For example, alpha-1 blockers can be included too, okay? For example, carvedilol, labetalol can be used also as alpha-1 blockers too, okay? Not only the beta blockers. Okay. Combined alpha-1 and now we have the last minute, and now we are continuing, and the question 1, okay, here. And the question 1, 70-year-old, 76-year-old man with a history of prostatic hypertrophy has a recent onset of increased difficulty urinating. Now, when people have urinating difficulties, so what type of receptors are used for this treatment? We can say the alpha-1 receptors, okay? And now urinary retention is related with it. Symptoms began shortly after he started taking a nasal decongestant, okay? Nasal decongestant is what type of substance used for what? Now, for example, phenylephrine was used as a nasal decongestant, okay, orally for cold symptoms. And which one can be the answer? Which of these
The correct
following
option
factors
is
is
beta
most
2.
likely